welcome to another episode of Nurturing Beginnings, the podcast where we discuss everything related to motherhood, parenting, and the beautiful breastfeeding journey. I am your host, Izzy Agdipa, and today we have an informative episode lined up for you. To begin with, I'm not the only one speaking for today's podcast. We have a guest joining us today and someone who attended a highly respected university and is now a licensed practical nurse. So without further ado, please warmly welcome Nurse Kimberly Hampact. Hi Nurse Kim, how are you? I'm perfectly fine, thank you. Good to know. Okay, we won't take this any longer. Do you have any insight on the importance and benefits of breastfeeding? Well, according to the World Health Organization, breastfeeding is not just about feeding babies, but also about bonding and promoting health. It improves cognitive development, reduces obesity rates, and lowers the risk of chronic diseases. Also, breastfeeding exclusively for the first 6 months reduces infant mortality. Wow! Many new parents often wonder how their baby should usually eat. Nurse Kim, do you have any thoughts on how many breastfeeding frequencies can vary depending on the baby's ages? Yes, there is. So, based on CDC, breastfeeding frequency for newborns is usually every 2 to 4 hours. It is important to ensure they get enough milk by counting the number of wet diapers. Basically, there should be more wet diapers for a newborn as each day goes by. In addition to that, I've read an article and according to Mr. Barkat, breastfeeding frequency decreases as the baby grows. But each feeding may get longer, so it may increase about 3 to 4 hours and then eventually they may develop a more predictable feeding pattern. Absolutely right! Also, it is crucial to remember that each infant is different and has unique breastfeeding needs. Wow, it is nice to hear about the frequencies many babies can get, right? Well, let's move on to another question. So Nurse Kim, based on the comments in our channel, parents typically ask for the baby's position while breastfeeding. Do you have any recommended position for them? Oh, well, there are several positions for breastfeeding, including the laid back position, cradle hold, cross cradle hold, football position, and side lying position. However, there is no best position that I can recommend. And it is because it depends on the parents how comfortable they are while breastfeeding their babies. Well, speaking of positions, since we were talking about the positioning, can you tell me some easy cues that the baby is starving? Well, babies show hunger in many ways, such as rooting, sucking on hands or fingers, smacking lips, and making sucking sounds. However, crying is a late hunger cue, so parents need to respond to early signs to ensure the baby's satisfaction and comfort. Also, for the last and final question, are there any risk factors that parents may face and when they should contact their healthcare provider if they see any signs of infections? According to Carl Sloan, yes, breastfeeding can be challenging and can come with the risk of infection, such as mastitis. Parents must care for themselves and be aware of symptoms like pain, redness, swelling, and fever. Seeking prompt medical attention and addressing risk factors can help ensure a smooth breastfeeding experience. So if you see any signs and want an urgent response, you can call this phone number, which is 1-866-797-007. Also, there are many websites for moms or parents to visit and ask for supports and guidance. You can search ilka.org. That's amazing, Nurse Kim, and thank you for the wonderful and helpful information you gave us today. We really appreciate your presence here and continue serving people who need help. Take care. No worries, anytime. Thank you as well for having me today. Well, that's it for today's episode. For moms or parents worldwide, if you have any questions or want to share your breastfeeding experiences, we would love to hear from you. Also, if you want to have it in person, you guys can go in this address, Lake Ridge Health Oshawa Hospital, and set an appointment with them. Remember, breastfeeding is a journey that requires patience, support, and love. Thank you for joining us today, and as always, I am Izzy Agdipa, your host for today, and stay tuned for more insightful episode on Nurturing Beginnings.